You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Welcome back, Health Innovators. On today's episode, I am sitting down with Kathleen Ellmore, who is the co-founder and managing partner for Engageus. Welcome to the show, Kathleen.
Thank you, Dr. Roxy. I'm thrilled to be here.
It's so good to have you. So today we're going to talk about a topic that we haven't really touched on a whole lot. We're going to focus on a lot of engagement. So when we're usually having conversations around commercialization on this show, we're talking a lot about the business strategy, targeting, product, messaging, branding. But what I really want to focus on with you today is, that last mile of communications, because a lot of folks that are in our audience would be folks that have invented some kind of innovation and they're selling to health plans or providers, but they're in some type of B2B2C model, right? And so being able to sell their innovation to that customer is one thing, but being able to drive engagement within those members or that patient population is really just as critical for that commercial success. So let's just talk a little bit about your background and what you do, and then we'll just jump right in.
Sure. So to give my background, I started my career at companies like General Mills and Procter & Gamble. I like to say getting you to eat when you weren't hungry and buy things you didn't need. And so I was thrilled to come over to healthcare in 2005 and start using all of those consumer methodologies, behavioral science, data analytics, A/B testing, to get you to do good things instead of evil. And so I landed at a company called Silverlink. There I launched over 1.5 billion consumer interactions using A/B testing, and very quickly peeled back that onion as to what works to drive what specific populations to what specific behaviors. And the cool thing is it gets really personal fast. And so having all that insight, it's not a one size all fits message. To get folks to do things, you really need to understand not only what motivates you, but what your barriers are and how to overcome those, and then kind of get you out of your inertia. Even if you believe the motivator, I've overcome your barrier, it's still not like buying sneakers, right? You're not running out there to get it done. It's right. Easy to drag your feet. And so we kind of cover the end-to-end spectrum of engagement for folks to help nurture behavior change all the way through to final action. And so we started Engageus, my partner and I, about 5 years ago, basically to decouple it from the technology we were working with and help everyone drive better engagement.
Well, and I like what you said on the positive side, right? The good side of motivation and driving consumer behavior.
Exactly. So and you mentioned, digital health. I always say to folks, just, if you build it, they don't necessarily come. And that's the challenge with all these amazing innovations and technologies we have to help consumers manage their health, and yet they're not using them, right? So that's that last mile piece you mentioned, is to really get them not only to trial and adopt, but to actually sustain their engagement throughout.
Yeah. And I think that it's kind of a missing part of the equation. As entrepreneurs and innovators, we have so much to pay attention to, right? And so many decisions that we're making that are part of that, commercialization strategy. And sometimes we often think that once we got a paying customer, like that's the end, instead of driving the paying customers to do the things that they hired us to do.
That's so right. And, it's when you sell into a health plan or a provider system, they don't realize the value until those consumers get engaged. And so just because you overcame that hurdle, you still have to help them get those consumers on that platform, using that app, engaging in the digital health. Otherwise, at the end of the day, there's not enough value for the person that you sold to. So absolutely.
Yeah, exactly. And, I think that's why that oversight is why we have so many mobile health apps that are just cobwebs, right? I mean, it's just, they're great solutions, but they have really low adoption rates and low engagement rates. And so let's talk about some of the things that our audience can do going forward to increase that adoption and that engagement, really kind of generic, like for all innovations. What are some of the best practices that you've gleaned over the years?
Sure. So one of the key best practices that we're seeing more and more from folks is multi-channel. it can never be one size fits all channel. And the great news, there's no good news in a pandemic, but the only positive is it really accelerated the move for consumers to accept and use digital health and telehealth and SMS programs and things like that. So if you're not currently at, kind of offering consumers multiple different channels of which to engage with you, that you've got to start that. I mean, think of like Apple, right? You can go to the Genius Bar, you can call Apple Cares, you can go online for the FAQs, you can call in, right? And all of those get used. Consumers are the same thing in their health. Some folks are going to love telehealth. Some people still want humans. Some people don't even want to talk to humans and would rather manage through the app. So you have to have all of those different channels. Another best practice is really understanding behavior change. And an example I love to use is colorectal screenings. If I asked 5 people that looked demographically similar, hey, go get your colorectal screening, and they said no, I'd hear 5 different answers of why not. It might be that, someone like you, Roxy, just doesn't have time, but someone else is afraid of that prep. And so if I say to you, Roxy, hey, the prep is so much easier these days, the liquid's not as bad or whatever, and your barrier is time, that's just noise. And so it's really, again, honing in on that personalized message to help those consumers overcome whatever's stopping them. And then the last area that's really become a best practice is to closing those barriers that are driven by social determinants of health. And that's a much bigger deal, right? I don't have a one size all fits solution for, all of these digital health folks of how to do that. But there's all kinds of baby steps to take to make sure that you're engaging those folks, meeting them where they are. And a great example of that is you might say to someone, hey, go get your A1C. If that consumer hasn't even picked a primary or gone to a well visit, you driving them right to something that's a little bit more down the path is, again, going to be too hard for them. You really want to meet them where they are on that journey and just keep, nurturing them along.
Which is so important. So, these are practices that other industries, like you pointed out, have been really applying to their businesses for so long, right? And so healthcare, as an industry, we have such a great opportunity to kind of catch up on how we engage patients. What are some of the barriers, right? So, when you're working with innovators or when you're working with some of your clients, when you give them these strategies and these best practices, what are some of the resistance that you see of really adopting this type of omni-channel approach?
Sure. So it differs by kind of by segment of the industry. So, when it's health plans, what is their biggest barrier is their own kind of legacy ecosystems. They're dealing with, in some cases, antiquated technologies, siloed or operations, legacy infrastructure. And so even something as simple as sharing data, right? If you tell your health plan your preferences, I only want email when possible, and I want to speak, my primary language is Spanish. Their ability to share that across all of those stakeholders is challenging. And so you'll be annoyed if someone asks you and marketing delivers on it, and then 3 days later, clinical sends you an English message. And so how to overcome those really kind of legacy boulders is their biggest challenge. In the digital health area, they need to be able to have integrations with these larger systems to become part of that ecosystem in terms of data sharing, because all of these point in time solutions only have a fraction of the picture. And we're humans, right? It's a whole centricity of how I manage my health. And so not having other kind of inputs or pieces of the puzzle leaves you, hampered, basically. And then that last piece is, I think we're slow to adopt behavioral science. I love infusing behavioral science into healthcare communications and just seeing the magic happen. Even something as simple as we were helping a health plan help their CAP scores. And so they were talking about their Medicare rewards program. And so they said, our Medicare rewards program, Betty Senior. And we said, no, it's not our Medicare rewards program. It's your Medicare rewards program, because ownership leads to satisfaction. And there's this whole idea of FOMO, right? If I own something already, I'm going to be more likely to use it than if it's something just kind of out there that I could join.
That little simple change can be so powerful, and it's so overlooked. It's really easy to look at just broad strokes of healthcare communications and see how even today in 2021, a lot of it is about them. It's about what they do, what they offer, how they benefit you. And it is, for years, it's a lot of arm wrestling of really going, hey, guess what? It's not about you. And it never was about you.
That's right. I love to use the examples from the outside and bring them in, that we take for granted. And by the way, consumers no longer compare us to their other healthcare experiences. They're comparing us to their favorite brands. And so that bar is high. Two examples actually I love to use is one is how many different ways do you think you can personalize a beverage at Starbucks? Do you want to take a guess?
Oh gosh, I don't know. I mean, I would say at least 50.
According to Forbes, it's 18,000 different ways you could personalize your beverage, right? I mean, crazy town. And then the other example I love to use is Netflix. When you get back on Netflix, it's right where you left off. They know exactly what other things you like. They know what your family likes and can make recommendations. And you go into your healthcare system, and there's so much that's kind of just one-off, right? You call the call center and you feel like you're telling the story all over again of what was transpired 3 calls before. And so tying those interactions together to become an interactive, cohesive experience is also that next frontier that we need to conquer.
It's funny. I call it the Amazon effect, right? It is kind of like we all love that Amazon experience, at least for the most part. And it is really, like you said, it is set our expectations and raise that bar so high that we just expect all consumer experiences to be that smooth, that easy, and that personalized.
That's right. And they use behavioral science beautifully, right? Like 4 left in your cart. My kids run and say, I've got to order it. And I'm like, no, it's a tactic. And they don't believe me, right? So it's like, we've done that with home visits. If we want seniors to accept a home visit, we'll say, hey, there's one left next week of one of our best reps. Can we squish you in? Versus, do you want to schedule? And then people say, well, I'll call you back, So there's lots to be learned from that. But I will say that the current industry has the advantage because as much as they have the consumer principles, healthcare's hard. And so for the folks that are already in it, they will win the long game, but they've got to pull in these tactics and these strategies from outside of healthcare.
So one of the things that I think is so fundamental to set these healthcare organizations up for success, applying a lot of the things, is just really an overall digital transformation mindset first, right? Then the technology, then the platform, but just this mindset, because it really, in order for, organizations to really benefit from the things that you're talking about, we're not going to be able to do that with just humans and being able to, manage these huge data sets. So what is your experience or perspective on just the digital transformation that's starting to and kind of taking place within healthcare?
I am super excited. I have been talking about consumer engagement since 2005. And at the time, it was really about a whisper. And even when the ACA happened, people were still kind of thinking about consumer engagement as tweaking the message. But honestly, in the last 3 years, our clients are everything from national plans to provider systems to small plans, digital health, you name it. Yeah. And everyone's thinking in the transformational mindset. Now, maybe, the head's thinking and the body hasn't caught up yet, but everyone's thinking the right things. And what's cool is there's no one way to get there. We have plans that have done, inventories of all their print to decide what can be reimagined, what can be consolidated, how do I think about applying that idea of next best action? We have folks that are taking it from the top down. How do I just personalize the heck out of this and coordinate across the data streams? So there's all kinds of great islands of excellence happening. And so we're just going to continue to see that grow.
Yeah, I definitely agree. And I think that's kind of a must, right? So for those organizations that have that mindset and are starting to connect it a little bit more, like you said, between the head and the body, are going to have a competitive advantage. That's going to be a winning strategy for their organization. And for those that take much longer, they're at risk of losing market share.
1,000%, especially in Medicare, consumers can now vote with their feet. So if they're not getting what they need, right, they'll go elsewhere. We've been trained.
So let's shift just a little bit, but to text messaging. So we're seeing in other verticals this mass exodus, if you will. I shouldn't say exodus, but this mass shift from email communications to SMS communications. And I think that that's so important in healthcare for a number of different reasons. But tell me what your perspective is on about what's happening with SMS communications in healthcare.
Sure. No, SMS is a fantastic channel. First of all, it's with you, right? And when you're making health, you're in the doctor's office for 15 minutes, and then you're making health decisions 24/7 for the other 364 days. Do I eat that burger at the restaurant or the salad? What's the pollen count today? All those kinds of things. So SMS text is a fantastic way to communicate with consumers on condition management programs and be there in the moments of the decisions that they're making and provide that support and guidance. The second thing is little tiny reminders like, refill, RX adherence, well visits, all those kinds of things. Text is also a beautiful channel for that. So, and we're finding that consumers, even when we push out one-way messages, they're responding. They're actually wanting to have a two-way relationship with their plan, which is really exciting, and with their provider offices and things like that. So I think sky's the limit for how valuable text is going to become to helping folks manage their health. And we're still really at the infancy.
Yeah, I completely agree. A lot of the work that we've done, we're seeing that you've got at least 90%, sometimes 95% engagement via SMS, where you might be closer to around 15 or 20% via email channel. Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit. So that doesn't mean that you want to go away with email, do away with email, because like you said, it's still about personal preferences. So you still want to engage that other percentage that maybe doesn't prefer SMS or still have the humans on the phone for those that don't want digital at all and they still want that human touch.
That's right. And the thing we have to be careful about is, consumers are a dynamic, living, breathing entity in the sense that right now, it's still pretty new, so we have tons of engagement. We oversaturate or we stop driving value through that channel and we'll lose them. So it's really critical to make sure that your text programs count. We did a great text program with folks in the Medicaid population, which are traditionally harder to keep engaged.
Yeah.
And we had over 80% stay engaged with 52 weeks of messages on their condition management programs. And I don't know about you, but I unsubscribe from Nordstrom 3 weeks into my emails because I'm done with getting those messages. So they found value in all 52 weeks of messages. That's the critical piece is we have to personalize it. We have to make it valuable. We have to make it about that consumer, or we'll saturate that channel and hurt our chances of continuing on with it if we don't treat it sacredly,
Yeah. And so what I hear you saying is really kind of 3 things that stand out is that this omni-channel, right? Being open to other communication channels beyond fax, right? Having a personalization strategy. So knowing enough about your patient population to be able to segment that in an appropriate way. And then this emphasis on value, because I think what you're saying is that we might have a text campaign. It might be personalized, but if we're not delivering value, all you do is just stop. And now you've just opted out of that channel. It's so easy compared to some other channels to just opt out.
Exactly. So if you haven't already used it in healthcare, make sure your first program is amazing because that's going to start that relationship off right.
Yeah. And I think also I want to just kind of touch on, I've seen this shift over the years where, I might have a patient population and I speak to them all as one homogeneous group, right? And then I maybe get a little bit more sophisticated and I go, oh, well, you know what? These oncology patients are very different than these MS patients. So I need to talk to them differently. But what I hear you saying is that that's still not going far enough because even all oncology patients, our MS patients, are still not the same.
Right. We've done programs like A/B testing where we'll say to all folks that are living with diabetes, hey, you're behind on some screenings for your condition, go get your screenings. When we say, hey, Dr. Roxy, you're overdue for your A1C, and Kathleen, you're overdue for your eye exam, we actually get 3 times the lift because we called out what is actually for you and not even just you as a segment. So it works all across the board.
So so one of the things that I hear in response to this is, how do I even do that? Like, how do I personally, like what am I supposed to put in place to be able to have this type of segmentation and then to be able to deliver these personalized messages across that population?
Sure. So it's all about the data. And so sharing that data across your ecosystem and doing it in ways that protects PHI, that, is usable for the right reasons, for the right apps and all those kinds of things is a giant challenge. And so we see in some cases, we have, plans that we see that, it might be that Kathleen is, the first name is in the first field in part of your organization, and then your last name is in the first field in a different part of the organization. So there's a lot of data standardization and normalization that needs to happen. And then putting in the people process technology to be able to kind of use that data in an actionable, dynamic sort of way. Things like communications control, next best action, personalization, but it all starts with the data.
Yeah, that's so true. So one of the things that I want to point out too that you're talking about is, you can have a messaging strategy where you have one segment of the population where it motivates them and drives them. And then that same exact message actually be counterintuitive or counterproductive to what you are accomplishing, right? So instead of taking the action or being neutral, they actually maybe opt out, or they actually may revert back to, right, dig their heels in a little bit. That's the behavioral science part that you're talking about. How do you help clients navigate that, being able to match those motivations and those behaviors to what that message is going to be and how it's being delivered?
Absolutely. We do. We actually have data scientists on staff that do a lot of work with us on predictive analytics, willingness to engage, figuring out where they are in their journey. Folks that have we've done over 250,000 barrier studies in the past, so we know what those common barriers are, and we can attach them to segments based on, who looks like someone else. And so we start there, but there's always opportunity for some A/B test and to get better and better because all of the populations, although they might be similar, they're not the same. And so kind of testing on your population, what is that best strategy is always helpful.
Yeah. So you mentioned something, a PHI. So that's one of those things that I find that often compliance and legal teams will just kind of use it like, oh, we can't do that. It's HIPAA and PHI, right? And they just throw these things around. I think that like us, people that are commercializing innovations or marketing innovations, we wrestle with them and we go, let's get specific on really what those things mean and what we can and can't do instead of just kind of using it as a blanket. But you and I were talking earlier, and you had touched on this new ruling by the Supreme Court around Facebook with SMS. So just give our audience a little bit about the information about that new ruling and what are some of the implications that you think it could have for those innovators in the audience.
For sure. And we don't like to give out, legal advice, obviously, but the ruling actually gives a little bit more opportunity to reinterpret the text messaging and, not thinking of it as spam. And so we told all of our clients, go to your compliance groups and talk about this, because I think it really opens up the opportunity to do much more. But at the same time, I actually do love when you, can capture permissions from the consumer, because even if the ruling says go crazy, right? It's going back to that idea of like, well, what do I want via text? What I want via email? And I like my bank statements via, electronically, but I might like something else in paper. I still get to choose. And so I do think that there's a lot of opportunity and permissions, but we should all be driving towards as much digital as possible, because it allows you to have that two-way interaction with the consumer versus the one-way.
Yeah, which I think is really important too, because it's not even a one size fits all with the permissions, as you just kind of mentioned here. So, as a consumer, don't just give me the choice between do I want to communicate via text or email or phone, but make that even more granular, because like you said, some things I might want via text, but some things I might want email or a phone call. And that flexibility and personalization at that level is so critical.
Absolutely.
Yeah. So, what are some of the lessons learned that we haven't talked about yet that you want to make sure that our audience walks away with?
Sure. So I encourage everyone that's listening to do A/B testing. Now, we've learned so many of the insights already from our 1.5 billion interactions, but we're still in our infancy as healthcare consumers, and the lessons have not all been learned yet. I like to give examples from my past life. I used to work for Digitas, and we had 20 years of data on helping American Express and AT&T Wireless, and so we knew that if you tilted a stamp, even like 10 degrees, you get 5% open rate on the direct mail. And if you did a second window on the envelope, you'd get something else. We have yet to find out all the secrets, right? It's not one silver bullet, it's millions of silver bullets, because it goes back to the idea that the behaviors and the benefits and the barriers and the inertia around mammograms are different around RX adherence. I'm great at getting my screenings and I'm terrible at med adherence. So figuring out the ways to motivate me and all these little different actions, it takes understanding and work and insight and data. So everyone out there, keep A/B testing and then email me and tell me what you found out.
So what do you say to those organizations or leaders that don't feel like they have either the budget or the time to be able to do that A/B testing and want to kind of skip over that research or skip over that testing and kind of have maybe confidence because of previous experience, maybe of a specific direction? Do you ever encounter that?
Oh, all the time. We always hear, no, we can't do control groups. We have to talk to everyone. And so we do a couple of things. We say, well, you know what, for sure, if it's a cancer screening, you're not going to hold it back, but you can hold out for like 6 weeks and then you'll know, treat them as a holdout group. And then you'll know what the difference is and then let the rest of the communications go. Or don't do a control group and just do an A/B and just pick one tiny thing to change, the subject line, who signs the letter, what the call to action was. Did you, give an 800 number or did you do a QR code, those kinds of things. We're seeing, like I said, every day, thousands of tests across clients. And the insight is it's really valuable to help iterate and improve those programs going forward.
I think buying into and supporting that type of experimentation is so fundamental to just every business's success, right? So not even just patient engagement or consumer engagement, just really across the board. This idea that it's not going to ever really be this one and done, but it's going to be this iterative strategy where we have so much data that we can look at, we can take the guesswork out, and we can make decisions going forward based upon the data, and then experiment. I mean, I've heard of companies that were just failing, being bought by other organizations and maybe just tweak the call to action. And then all of a sudden they have a viable business.
That's right. No, even like we said before, changing one word, yours to ours, right? Or yours to yours makes a huge difference. The examples I love to give is, when I was at Cheerios, I had one goal. I needed people to buy Cheerios. I didn't even frankly need them to eat Cheerios. And then my target market was super defined. It was, new moms that had brand new babies or husbands with bad cholesterol. And so you think about the messages to drive those behaviors could get really tight and succinct. Now, not only do I need you to do 37 things, RX adherence versus screenings versus well visits versus pay your bills, et cetera. But I have every walk of life, every income, education, socioeconomic status, you name it. And so there's no way that we can know all the answers, but we have a lot of the starting answers. And so continuing to refine until we get 100% engagement across. I mean, our health should mean more to us than our flat screen TV or our iPhone. It should be our favorite thing that we invest in.
We still have so much work to do, don't we, Kathleen? So I want to just kind of, start to end on this note, because I want to make sure I answer this question. You've got so much experience around consumer engagement in your previous work. So I want to ask you, what does Hamburger Helper, Betty Crocker, and healthcare have in common?
Absolutely. They all need to drive behavior change. And so whether we're driving behavior change through repositioning Hamburger Helper to more of a home style helper, or we're getting you to eat Betty Crocker desserts, but instead now we're getting you to do things that are better for your health. Granted, sometimes there's not that endorphin at the end when you buy something amazing. But at the end of the day, all of those same principles apply. Data science, behavioral economics, predictive modeling, all of that comes into play and can really, really drive behavior in a beautiful way.
Yeah. Yeah. So you just made me think of one more question.
Sure.
When we think about outcomes and being able to have real world evidence that our solutions that we're bringing to market actually can generate the value and the ROI that we said that they would, so that the performance of those tools are just so critical. Talk a little bit about maybe some of the work that you've done and how you're playing into being able to develop the real world evidence that's needed to be able to have that success story to lead to future sales going forward.
Sure. So we work with clients all the time to drive those outcomes. So it's not just engagement metrics, right? It's not just who opened the email or who answered the call. It's really about driving those outcomes. Did they get the screening? Did they go to the well visit? And then our other strategy that we love is to just find quick wins in no matter what projects we're doing. And so we were helping a medium-sized health plan figure out all of their print inventory to figure out what to reimagine to digital. And in doing so, we opened a bunch of letters and we saw this letter that needed some optimization. And so we reworded it, added a phone call to it. And one of the things that I mentioned before is it didn't address hidden barriers. It was asking women for a home visit to do their osteoarthritis measurement for stars. And so we said, hey, you don't even need to take your clothes off. And we didn't say it that obviously, directly, but that is a barrier, right? If you're thinking about having a home visit and having this osteoarthritis measure. And so we ended up driving a 35% year-over-year increase in their HEDIS measure. So just little changes.
Right. Huge real world business impact, right? So like you said, we're not talking about fluffy stuff of open rates for emails. Real business impact. Well, Kathleen, this has been so valuable. I know that our audience is going to walk away with so much wisdom to impact their business strategy and their engagement strategy going forward. So thank you so much for sharing your time and your wisdom with us today.
Thanks, Dr. Roxy, for having me. It was terrific.
Awesome.
Very fun.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and attention. To get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who shared the show with friends and colleagues. See you on the next episode of Health Innovators.